This episode of the Operatory podcast is brought to you by Opera VR Digital Nitrous, the immersive patient anxiety melting experience proven to be as effective as nitrous oxide with no drugs. True drug-free sedation with Opera VR. Go to digitalnitrous.com. Welcome to the Operatory podcast, the podcast about burying dinosaurs in dentistry, moving past outdated procedures and policies, just doing things the wrong way into a better way. With me today is David Pryor, providing our patient perspective.
Hey,
Thanks
Brian.
for being here, Dave.
Hey, Brian, what's shaking?
What is shaking? Lips and cheeks as we deliver anesthetic,
Oh,
Dave.
yes, the distractions.
The distractions, yes. That's what's shaking. So thanks for asking.
You're welcome.
So today we are actually talking about the 4 ways to combat the number one thing that people hate about the dentist.
Well, I happen to know what that is.
Yeah. What is it?
The needle.
The needle. That's why we're shaking lips
All
and
right.
cheeks today, because we're talking about delivering anesthetic.
All right.
And so because it's, we're all about providing the patient perspective. That's why our lovely man Dave is here.
Yes.
Yeah. Thank you.
Thank you.
For acknowledging that fact. Providing the patient's perspective. And so we are talking about, because we're about the patient perspective, we want to really do a deep dive in the one thing that people hate the most about being at the dentist. Does that not make sense, my friend?
That makes perfect sense.
So I broke it down, and I think I have 4 ways to look at closely in your office to see if maybe you're doing it the dinosaur way, and if there's a way for you to move beyond to a better way in delivering anesthetic. Make
okay.
sense?
Yeah.
So I'll kind of go through these one at a time, and then I'd like to get your perspective, Dave.
I'm going to be surprised if there's something that is new and shaking in anesthetic for
All the
dentistry.
time, man. All the time.
Interesting. Okay.
Now, yes, there is. And I think that at least new from your perspective,
Right.
for sure.
Yeah.
Okay. You may not note that these are going on. So it might be kind of cool to hear as a patient.
Yeah.
Number 1 is, what do you call when somebody gives you an injection to get you numb? What do you call that?
Well, I'm sure you're fishing for Novocaine.
Yes.
And that's all I know. I know it's an anesthetic, and it's probably not Novocaine anymore because that's a billion years old. So,
Yeah, exactly.
Yeah.
And there's,
You're also not using an ether mask, right?
I'm not. I can't vouch for anybody else listening, but I am not. Yes.
Okay.
Because, Dave, you know that. Because who's the number one person I would be using that ether mask on if I were? That would be
That
you,
would
my
be me,
friend.
yes.
Yes.
Is there a way to shut him up?
An ether mask is the answer to that.
Okay.
Yes. There's a way to shut somebody up. It's chloroform. No, we're not talking about chloroform, but we are talking about Novocaine because dentists haven't used Novocaine for a very long time. Like you said, I think had been used probably 40 years ago, because when I was in dental school, I think they said at least 20 years. So it's probably been like 40 years because people have bad reactions to Novocaine, and it's not very profound. And I think that most dentists now are at least using Articaine, which is what's being used to provide the most profound anesthesia today. This brand name called Septicaine, the chemical name is Articaine, and I'm a gigantic Articaine fan. There was some controversy when it first came out that there was some people having issues with Articaine, with it affecting people's nerves negatively. But what really came out was the research I've seen is when you use lidocaine, which is another popular one, and Articaine at the same time, there can be a chemical reaction that's bad. So you don't want to put Articaine and lidocaine in the same spot. And what people used to do quite a bit was put lidocaine in a spot, and if it wasn't numb enough, then they would go back in with Articaine,
Oh,
and that can lead to problems.
Gotcha.
Does that make sense?
Yep.
So I'm a big fan of Articaine. More profound anesthesia, and I've been using it a lot.
Yeah.
And so, patients who've had lots of lidocaine before, you can just see a dramatic difference. So that's number one.
Are you seeing other drugs that are coming out that you haven't experimented with yet? Personally, recreationally.
Not recreationally, no. What I would say is that there is another sort of on my list.
Yeah.
But before I go through that,
Okay.
let me ask you: have you noticed you probably? I mean, I'm assuming you haven't really noticed a difference in anesthetics that you've been given in the past. For you, it's just just get me numb. That's all I care about.
I I have I've had other procedures done where it was a local and they were ineffective, and so whether they were not hitting the nerve and this wasn't in dentistry, this was in I had something else done,
Yeah.
and it really it wasn't effective. But in dentistry, where I have noticed, I don't notice any pain. What I see when I go in from the patient perspective, what I see is a topical is applied, then an injection is given, and I feel nothing. Additionally, over the course of time, what I've noticed is that as I come down off of it, I don't feel as weird as it wears off. Like it used to.
So you have noticed a difference. That's interesting.
Yeah,
Okay.
because I remember it used to be that I couldn't. It was fairly difficult to go back to work and be articulate and be able to speak. As a salesperson, that's an important feature of my job, and so my tongue would be numb. I'd be chewing on my tongue and just not aware of how my face was working. And now I don't get that sense anymore.
I think you're probably going to be surprised that doesn't have to do with the actual chemical makeup of the anesthetic.
Yeah.
It has to do with something else on our list.
Okay.
A technique
Okay.
that we'll talk about.
Right.
But you did mention another piece that gets down to sort of the chemical makeup of anesthetic, which is the topical. Like the jelly we put on your gums. Yeah. There's actually many different versions of that too. I haven't personally experimented too much with different topicals, but I know there's people that just love. They're more profound topicals than what I use, which is benzocaine. Yeah. And so I'd love to hear from people their experiences with other topicals, because just like Articaine is much more profound when delivering anesthetic locally, the topical that's used can also be much more profound. And I think that it's lidocaine typically, but I'd love to, because I personally haven't experimented with different topicals too much, but I know that's kind of a thing that a lot of dentists have found to be very useful. So, but I'm going to lump those two into the same category. It's the actual chemical makeup of the anesthetics, both topical and local, that you're using. And if you're not using Articaine now, or if you're using it sparingly for the people that don't get numb, I've been using it almost exclusively, except for people that we don't use epinephrine with, for a very long time. Yeah. So that's tip number one. Take a look at your anesthetic and just make sure that you're using the most profound anesthetic that's appropriate for that patient that's in front of you. Because, again, we're talking about the number one reason why people hate coming to see us. So let's try to get them numb, right?
Yeah.
Number one is not to hurt people, so we need to have some profound anesthesia. Step number two is the needles that you're using. Did you know that there's been advances in needle technology, Dave?
I did not.
And I would guess that some of the dentists don't know that today too. And this is the reason why I haven't experimented with different topicals, because I don't have a connection with the company Septodont, but I use their needles because they're very sharp and beveled, and they have a little indicator that tells you where the bevel is, so that you don't, like, if you do inadvertently touch bone, that you don't hurt.
You can
somebody.
realign.
Yeah, exactly. And so you know exactly where it is, and the needles are so advanced now that even without topical, you can slip it in the gingiva and people don't even feel it. Mm-hmm. And so I would recommend, if you're listening and to the podcast and you're just ordering whatever needles that you don't think there's a difference between them, there is actually a very big difference, I find, in the needles that you use. And that is a key piece, because the one piece that, unless you're really using a very profound topical, that takes time and energy, right? Is when is getting the needle in. If people don't feel it, that's the number one thing we're trying to do, right?
Yeah.
So it's the needle technology is number 2. So if you haven't evaluated that recently, I would recommend it. The other piece we talked about before, number 3, is actually you talked about your tongue being numb.
Yeah.
We talked about on the 40-Minute Crown podcast how I deliver anesthesia, which is local anesthetic delivered like right by the cheek part of the tooth.
Yeah.
And then particularly on lower crowns where we normally would have to get that whole side of your face numb, figuring out how to give it on the lingual so that you're right just south of the free gingival margin. If you haven't listened to the 40-Minute Crown Prep, we detail the procedure there. But instead of giving blocks, giving local anesthetic just around that specific tooth. When you're using a more profound anesthetic like Articaine, it's relatively easy. It's a little more technique sensitive, but the patients are much happier when they don't have to have their tongue and that whole side of their face numb, like you were saying.
Yeah.
Does that make sense?
Yeah.
The other one, just for the, obviously we're talking to the dentist when we're talking about how to deliver anesthetic. Lower premolars, mental blocks with Articaine, and then putting a little pressure with your thumb, you can actually feel the anesthetic go into the mental foramen. You get that area very numb very fast. I just always tell people, make sure not to bite your lip because you get the lip very numb. So tip number 3 is if you give blocks every time, evaluate if local anesthetic delivered sort of the buccal and lingual is effective for you. The 4th tip that I would have to attacking the number 1 reason why people hate going to the dentist with anesthetic is actually a twofer, new chemicals that you were talking about that dentists might not know about. Number 1, there's buffers that we can actually add to our anesthetic to reduce the acidity and actually make it much more comfortable to have anesthetic administered. Had you ever heard of this?
No.
I bet a lot of dentists haven't either. But it's been proven that when you're delivering anesthetic, a lot of what is uncomfortable for patients is the pH of the anesthetic itself. And so right before delivering anesthesia, if you add the buffering solutions, they're great. Actually decreases the amount of time it takes to get the profound anesthesia, and also makes it much more comfortable for the patient. And there's actually anesthetic reversal agents that you can give right afterwards. So if you do have a salesman like Dave who's like, I have a meeting after this, you can put in a reversal agent, and that anesthetic will be gone within 20 minutes.
Oh, that's awesome.
Yeah. So we use it sparingly because A, it's expensive, and B, if somebody's not numb, the likelihood of them feeling it is higher. So
No, I get it.
yeah.
Yeah.
But if you're worried about somebody biting their lip or if they're complaining about anesthetic, it's a great tool to have in your back pocket.
Yeah.
Well, that's my 4 tips for you, Dave, about how to reduce the number 1 reason why people hate come to see us.
That all makes sense. That's
So
cool.
so if you were a patient hearing this today, would you ask for any of these things when you go to the dental office?
I might ask for the number 4 stuff, the buffer and the reversing agent.
Yeah, and those are which is, I would guess of our audience, those are probably the 2 things that they haven't heard the most about. I don't have the chemical names of the buffers or the reversal agents, but there's only 1 or 2 buffers, and I know that there's only 1 reversal agent out there. So contact your local Patterson or Shine Rep or Benco, and you can order it up and try it out. It's relatively inexpensive, and you can make a big positive impact on your patient experience, which is what we're about, right?
Yeah.
Thanks, Dave. I appreciate your perspective today.
Thanks, Brian.
I also want to remind you to rate and review us wherever you're listening to this podcast. And if you have suggestions or comments, please visit theoperatory.com and drop us a line. Again, I'm Dr. Brian Laskin, host of the Operatory. Thanks for listening. I look forward to speaking with you next week.